Transportation on first.
Hear me?
Can everyone see the agenda?
It came up in front of me.
Yep. Everybody hear me?
Which one? Transportation. Okay.
I think Commissioner Nash, is that you trying to speak?
I'm trying to, but for some reason it doesn't seem to be working.
I can hear you, Charles.
Oh, okay.
I can hear you, Charles.
Are you ready to start the meeting?
Are we ready to start the meeting, Madam Chair?
Yes.
All right. It is 3:30 in the afternoon. I will call the transportation meeting to order. Roll call, please.
Commissioner Foster,
Here.
Commissioner Hovey Wright,
Here.
Chairman Hughes,
Here.
Commissioner Laring,
Excuse.
I believe he's here. Commissioner Laring,
I'm still on mute.
Excuse.
Commissioner Mahoney,
I think he has his mic.
His mic is up.
Okay.
Commissioner Nash, Commissioner Skolnick,
I'm here.
Commissioner Snyder,
Unmute.
and Commissioner Wilkins.
Here. We do have a quorum. Roll call, please.
Just did that. Approval of the minutes.
What?
Oh.
Make a motion.
What is your pleasure? What is your pleasure on the minutes of March 12th, 2020?
This is Commissioner Hughes. Motion to approve.
I'll support.
Is there any discussion on the motion? Hearing none. All in favor signify by saying yes.
Yeah.
Yes.
Yes.
All opposed? None. The motion is carried. We'll move on to the information item. What is your pleasure on the information item?
Move they be
Motion
placed.
to be placed.
I need the ones to read that. Just a minute, please. What is your pleasure on TR 200302?
TR 20.
This was,
That was
this
last
was,
month.
those were last month's.
Oh, I'm sorry.
That's okay.
This is a little new. Just a minute. What is your
Commissioner,
pleasure?
this is Jim Coons. If you'd like me to walk through the match update that was sent to you.
Yes.
Yes, that'll be fine.
What we got?
Yes, please.
So you should have received or hopefully can be presented on the screen a PowerPoint presentation with a MATS update. I'll just walk you through this, and then at the end be happy to answer any questions. So in front of you here on the second slide is the typical MATS monthly operations report. Of course, as you can imagine, numbers are down significantly. March of 2020 versus March of 2019, and that is primarily due to the COVID-19 impact that we're seeing. That report will be available for you to place on file if you like. The third slide shows you in a graphical format what our daily ridership was starting March 1st in terms of total boardings per day. Of course, the first couple of weeks of the month were business as usual. And then on or about March 13th, we saw the impact really start to happen. During the week of March 16, we continued to run full service, but we asked customers to take essential trips only. And then effective on the 23rd of March, we reduced our program to Saturday level of service only. And you can see that that has, along with the other measures taken, brought us to about 1/3 of our normal ridership. The next slide, I was asked to show in kind of a map format what our reduced service map looks like. Now, these are the same 6 routes that we have operated on Saturdays for the most recent past. And so when we went to reduce service, we deployed these 6 existing routes. That way customers already had published timetables. They had all of the information they needed to make the trip, but they just know that we're doing the reduced service. So this is the coverage map of those routes. The next slide.
Realistic, could I ask a question of Jim, please?
Yes, Susie, go right ahead.
Jim, would you say that the people who were using the mats just for transportation have dropped off, and now it's the people who actually need it for their actual everyday life to be able to exist?
Yeah, I think so. And if I can go to the next slide and share some information on that, I'll show you who I think is still using it.
Great, thank you.
So, you know, in using this reduced service level, go back one slide, Ivan, to the route listing. There you go. This is a sample of the destination served by the remaining 6 routes. And a lot of these destinations that I've shown on here are what I would consider to be more transit-dependent oriented locations. So, for example, our 6th Street route, people are using it to travel to Meyer. The Mission for Area People Supper House is still in operation, as I understand.
Okay.
Department of Health and Human Services, apartment complexes, medical practices, Walmart. Same with Route 25. There are a lot of institutional uses that are still in working order, as well as Love in the Name of Christ and apartments along that route. The Getty Woods services a number of lower income housing and connects people to the other routes. The Harvey route is serving, you know, major retail that is still in operation, whether it be Target or Meyer, and some health facilities. Route 55 serves both hospitals, as well as the Walmart on Sherman and other retail. And then Route 60 services both Meyer and Walmart. So what we're seeing, and we're still trying to gather some numbers about trip purposes, but the people that are still out there are the people that don't have a lot of options. And I have a slide here. Let me see if it's on the next one. So yeah, the last slide here. Really what we determined when we did the route study was that 54% of match customers did not own a car at that time. And another 11% that they were not able to drive for either health. And so we still believe that that's more out there right now. Many do not have access to family support systems. And without the mobility and independence, they cannot access daily goods and cannot reach employment. And then finally, many are low income and cannot be assumed to have fully stocked pantries to sustain a household for extended periods of time. So really what we're seeing is these are still the people that need to get out every day. I cannot control their individual decision making. If there is somebody out for reasons that could, I have a hard time being able to guard that. But we believe we're still meeting that basic need. Our ridership is around 400 trips per day right now on the system, which again is about 30% of our normal weekday ridership at the beginning of March. So that is the report. I'm sorry, is there one more? Yeah, one more slide. And that's just, what are we doing at MATS to combat COVID-19? And I will say this is constantly evolving and it will change. So anything that I say today that may or may not satisfy everybody, but we're open to additional activities. We're constantly evolving. We are doing vehicle cleaning on a stepped-up basis. We're doing daily disinfecting of buses at the garage, and then drivers also have the means and direction to sanitize high-touch points every hour. We're encouraging social distancing, asking that people take the bus for essential trips only. We've implemented a rear boarding process so that the driver is somewhat isolated from the passenger compartment, and we are not collecting fares so that the drivers are not interacting nearly as much with the customers in a physical space. And then as needed, we're putting out a chaser bus or a shadow bus if we feel we need to distribute peak loads. That really was only needed at the end of last week. At the beginning of every calendar month, we see a peak in ridership. Those are typically people that have received their monthly income, and they are out gathering the supplies they need. And so last week, Friday, and I think on Saturday, we had some additional buses on the road, and we instructed the lead driver to pass up customers if he or she was exceeding a certain number of people on the bus, and then the chaser bus would be right there behind them to pick up those extra folks. In terms of PPE, we are making masks and gloves available for drivers. We have hand sanitizer on the buses and in the facilities, and that's made available to all customers and employees. And we are seeing that masks and scarves are being used by customers in a higher degree than we would have probably even expected before this happened. So those are some of the steps we're taking to combat this. And again, we're constantly evolving as new information comes out.
Jim? Right. Jim, can you hear me?
Yes, ma'am.
Yes. On the chaser bus, do the drivers automatically call when they pass? They leave someone standing, but they'll call a bus to come behind them?
So what we implemented for that was if a driver is seeing that type of load factors, we'll ask them to contact us and we'll monitor it through that hour. And then if it looks like the next hour we may need to put another vehicle out there, we'll do that for a few hours. So we are not leaving anybody stranded currently on the corners. We are monitoring it, and if it seems to be a trend, we'll send a chaser bus out.
Okay, thank you very much.
I have a question
Jim,
too.
I have a question for you.
Who is this?
Go ahead, Susie.
Jim, are you testing the bus drivers, taking their temperature and asking questions like they do to enter the county building?
We're working with Health West, and we do plan to implement that as soon as we can get some additional information and supplies from them.
Okay, thank you.
This is Marcia. I have a question. I heard on the news this morning that New York City buses were still running, but they were giving out masks for passengers, asking them to take one at a time. Is that something that we could do?
Well, if I had the supply of masks, I would say yes. I think what we're seeing is a lot of people are using their own homemade masks, and if we can identify additional supply for that, I would be willing to make that available.
I'd be willing to contribute some personal money towards that if that's the issue. But I know it's a mask. I tried to order one online and it was like $14.
Yeah.
So
Money's not the issue. It's sourcing is the issue. But you know, I was on a call this morning, and I heard from the Department of Transportation in Detroit, and they were doing something similar where they just made them available at the back door, but people were grabbing far more than they should have, and they were running out as quickly as they were putting it out there.
Oh.
And even if we had it and could make it available, I think people are doing that on their own accord to a large extent.
Jim, I had a question for you.
Yes, sir.
My question is that we can just block certain seats on the bus.
You were cutting out really bad, but I think that you were asking about cutting off certain seats on the bus.
Right.
Well, you know, we can do that physically. However, on a 35-foot bus, maintaining a 6-foot social distancing is nearly impossible unless you're going to carry just a few people on board. So we haven't gone there. We can consider that further.
A question?
Yes,
Jim, do you
Commissioner
know?
Foster, go ahead.
Thank you. Jim, what is the actual ridership per hour on the route you are running currently?
If you give me just a moment, I can try to locate some of that information for you. It's down from our normal.
Yeah, if you go back to your route you're running.
Yeah. So if I look at the data from yesterday, the 8th of April, on a passengers per hour basis, system-wide on the fixed routes, it was 7.4 passengers per revenue hour. Now, there are some routes that are less busy than another. So one of the routes might be doing 5 people per hour and another doing 9 people per hour. But on an average, it was 7.4 passengers per revenue hour yesterday.
Okay, thank you, sir.
And that's the number of boardings. That does not mean that 7.4 people were on board at the same time. You know, 3 people may have gotten on at the terminal and gotten off halfway through the route, and then 4 others got on somewhere. So that's just an average per hour on the system yesterday.
But Jim, from what I'm understanding from your report, basically what you're saying is that the ridership that you're seeing right now are people that absolutely have to ride the bus. They don't have another means of transportation. And pretty much all of these people are going to places of essential services.
You know, we don't have the trip purpose information, but I think that is a logical assumption based upon, you know, what we're attempting to do and the directions that have been given by the governor and locally, that the people that are out there because they need to go either purchase something or they either need to make money or spend money for an item. And, you know, that's most of what's out there. I think there's also an element of people that are going out to check on others. And I cannot tell you how many of them that may be, whether they're checking on their mother or grandmother. But I don't believe people are out there indiscriminate.
Thank you.
Okay, are there any other questions?
Bob, you're talking,
Thank you,
but your
Jim.
microphone is off.
You can, they can hear you.
Okay.
Bob has a question. Commissioner Skolnick has a question.
He has to unmute his microphone.
There
Can
you
you
go.
hear it now?
Yes.
Yes.
Okay. You know, I don't know if, I think Ivan is controlling this, but this is just kind of a housekeeping thing. But when that agenda is up there, it's very difficult to see who's talking. You can't see anybody other than the people at the end of the screen.
You got to scroll to the left or right to find that person.
Right. But I don't know if the agenda needs to stay up there when there's discussion like this. Anyway,
question.
one of the things I wanted to say was that I'm glad that we got some of the data we got, because it appears that at least 65% of the riders have no other way to go anymore. They either could not afford a vehicle, or for one reason or another, medical or other, were not able to drive. One of my reasons for supporting the motion that was brought up, I think at the last meeting, about keeping the buses going was for this very reason.
Right.
I know there was some comments made online that I didn't want to lay off any drivers or anything. And I can tell you that's the last thing on my mind. My big thing was serving the public as best we can, particularly people at the lower end of the, income stratus. There are, I don't know how many, but there's hundreds of people who really depend on the buses to get around at all. And I don't know if it's time to stop running the buses. Did somebody say, I heard somebody say that the buses in New York City are still running?
Yes, that was me, Marcia.
I don't know, I haven't seen that anywhere, but
It was on NPR, yeah.
New York City is a hotspot. And I'm still in favor of buses running unless there's some overriding medical concern that we shouldn't run the buses right now. I don't know
would agree.
Is Kathy Moore still on? Kathy, are you there? I don't see her. It looks like she may have walked away for a minute.
There she is.
There she is. Kathy, did you hear the discussion about what I just said about the need for buses for people who have no way to get anywhere?
I'm sorry. No, I stepped away to answer another call. So what was the comment?
It was just that, we voted at the last meeting. There was a motion to stop the bus service. And I think it passed. It was more than I think the vote was 6-3 to keep the buses running. I voted for it because I was concerned about those people who have no other means of transportation and can't afford. I think a cab is even more dangerous than this. And I'm just wondering what your thoughts are on it right now. I don't know if you heard Jim's discussion about where the buses that are being used, where they go now, and they're all going to necessary places. So I don't know. What are your thoughts, Kathy?
Wow, this is so difficult, because I agree those essential workers, if they're going to a nursing home to take care of a very vulnerable population, or if these are hospital workers that need to get to the hospital to take care of patients in the hospital, we need our first responders. We need them, and we need them to report to work. If they are going shopping, we have, my concern, if this is just shopping, this is again contributing to community spread. So it is, people do need food, but we do have other agencies and sources to help those people get food. So we've worked as a community agency group for individuals to call 211 to describe their situation, and somebody will work with them on getting food. But the essential workers that's going to the nursing homes and going to the hospitals, I say, yeah, we still need them. But those who are just going out shopping, they are actually contributing to the spread in the community.
Okay.
This is Mark. I want to bring up a point here. Ivan Phillips, could you unmute Commissioner Laring? He would like to join the conversation, but he's muted.
I'd like to add something.
I can find him. Just a second
Chair
here.
Wilkins?
Yes,
Yeah.
go ahead.
Yeah, because of my age, I tried to use some of the shopping services, like through Myers and then somebody suggested Aldi's. So I ordered stuff on Monday that was supposed to come that afternoon, and I won't get it until Friday. So they're overwhelmed as well, the shopping services. So Aldi's has they shop for you and then deliver it, and Myers has shipped. So, that service is available, but it's overwhelmed right now. So, I mean, good thing I had enough food to last till Friday, but it was delayed 4 times.
I'm going to go ahead and unmute everyone so that Commissioner Laring can get in, and then please everybody mute themselves if you're not going to speak, okay? So this.
All right, that's all.
Hey, there is a huge Is Commissioner Laring on now?
Is Commissioner Laring on? I don't think
You may want to be careful about unmuting everyone because there's a lot of people on here for the staff.
Charles. Was that Commissioner Nash?
Yeah, I was just saying that I didn't know if you really wanted to unmute everyone because there's a lot of people on here and it's much more than staff. So
Right, everyone's
that's
been
why
muted
we're getting
back
the
out. I
feedback.
can see that. I couldn't tell. All it says is caller 1, 2, 3, 4, 5. I can't tell who's actually called in.
Right.
Okay. Were there any other comments? Okay. Thank you, Jim. Now we'll go back to the agenda. There we are. Okay. We're now at items for, is there anyone, we're looking for the airport report. Is Bob there? Okay, Bob, you may go ahead. Is Bob Lukens on board?
Now? Hello?
Hello?
Can you hear me?
Okay. Bob, you may go ahead with the airport report.
Yes. The airport is still functioning at its normal capacity. The flights are still happening every day. We have 2 flights per day every day, but Tuesday and Saturday, in which we have 1 flight per day. But the airport staff continues to work their regular shifts. and they are doing airport inspections, upkeep on the airfield, and other work on vehicles and equipment, and also doing some of the landscaping work that is needed. Last week, they were working on some brush clearing along the fence lines and such. Airport staff is also sanitizing the passenger areas and the bathrooms before passengers come in for flights, and they are performing other general maintenance around the airport and to assist our lessees at the airport. Again, we are flying every day. The flights that we have as an essential air service airport are 2 flights per day, Sunday, Monday, Wednesday, Thursday, and Friday, and then 1 flight per day, Tuesday and Saturday. SkyWest is in discussions with the U.S. Department of Transportation to reduce that to 1 flight per day, every day of the week, because the load factors are quite low. Turnarounds for the airplanes when they get here, they come from Chicago O'Hare to Muskegon and then go back to Chicago. The turnarounds are a bit longer because the airlines themselves are taking quite a bit longer to sanitize the planes on those turnarounds. And we also have been meeting with the FAA to discuss some upcoming deadlines that we have. There's a live burn training that is conducted with the Norton Shores Fire Department. There's an annual runway safety action team meeting that talks about potential runway issues or emergencies. And then we have wildlife hazard and fuel training, and those are not due until August, so we have some time on them. But we have been in discussions with the FAA about the airport and to push back some of our training deadlines. The FAA does expect us to complete that training though, so we will be doing that in a timely manner as best we can. Some of the meetings can be conducted via WebEx or Zoom meetings, so we will be doing those, but we are in contact with the FAA, you know, in case any changes are made to the national air system. Earlier this month, or I'm sorry, that would have been later in March, the FAA put out a request for airports that could potentially be able to park planes because the airlines just don't need all the planes that they typically fly during normal operations, so they're beginning to park planes. So we do have space at Muskegon County Airport to park a number of planes. We made a request that if they do decide to park planes at our airport, that they would do it, that they would park the smaller planes. We have much more room for the smaller regional jets that typically are used by SkyWest and United Express. So the FAA is aware that we do have room available at the airport if necessary. But it seems now that mostly they're parking the larger planes and using the regional jets for regular flights, like, you know, say from here to Florida, because they just do not have the load factors that they've had before the crisis began. And that is basically my airport update. If you have any questions, I'd be happy to answer them for you if I can.
If I may, Bob?
Thank you, Bob.
Sure.
Go ahead. Who wanted to speak?
That was me, Realistine Gary.
Oh, okay,
Bob,
you
Bob,
may go
speaking-
ahead, Gary.
Thank you, ma'am. Speaking of load factor, Bob, what is the load factor on the planes leaving right now out of Muskegon?
It's quite small, anywhere from 1 to 5 or 6 people.
Compared to normal time?
Typically, normal times we get about 80% load factor. So, you know, we'll get on a 50-seat plane, we'll get 40, 45 sometimes. Occasionally in the summer months, we will have full planes, all 50 seats filled. But typically we get about 40 seats filled.
So right now you're down to around 5, you say?
Yes. It all depends. And that's why the airlines are looking at reducing it to 1 flight per day at essential air service airports because there just isn't the traffic there. And the same thing's happening at the Grand Rapids Airport. You know, it's not as drastic as ours really, but their flights, many of them have been canceled and combined into fewer flights per day because there just aren't the people flying at this time.
Can I ask you one more, ma'am?
Yes,
So,
certainly.
Bob, when they're coming in from Chicago, how long are they in our terminal, and what is the chance if they have anything with them that the terminal would pick anything up?
I would say if the people themselves that are flying are not infected, the chances are pretty low because they are really taking quite a bit of time on the turnarounds to sanitize the planes. So anywhere people are walking or touching, they are sanitizing the planes. And these are small regional jets. So they're not really, you know, they're not the big 150, 180 seat jets. So it's much easier to clean and sanitize them. But I would say the chances are relatively low, again, unless the person flying is infected.
Okay, thank you.
Mhm.
Where's the agenda? Are there any further questions? All right, we'll move on. There we are. All right. Is there? I think we were here, right? Yes. At this time, we'll go on to public comment. Is there any comment on an agenda item?
Yes, this is Ann Derwin. May I continue?
Yes.
Okay, each one of you received an email from me regarding closing down the MATS bus. After I've heard your review, I'm still in favor of closing down the MATS bus system, but could you limit it to only essential workers, keeping the 6-foot distance, and protect our drivers? The email I sent out to you was very sincere, and I was concerned because it involved everyone in our community, and especially those riding the bus and the drivers. A response I received from only one of you, only one responded, but the one response I received was, yeah, a friend of another commissioner. That commissioner, Charles Nash, is the one that sent that response. You are all here to make the hard decisions, not to make sarcastic responses to sincere requests. And if this request to close down the MATS bus is denied, it could very well cause more deaths in our community. This response was a disgrace to the position of a commissioner, and that commissioner being Charles Nash. Now, we do know a 57-year-old man died, and we know that he traveled the bus, and he has now infected probably a lot of people, not only through the bus system, but from the church he attended as well. And I respect all of your positions on this, the positions you held before, because it is a hard decision. But I'm asking you to reconsider this. This is for the good of our community, and we are under a stay-at-home order by our governor. And perhaps Kathy Moore would know of other people that could be involved in delivering food to these people that are in need. Thank you.
Thank you for your comment. Is there anyone else? Okay, we'll move on to.
One comment? How do I close this?
Did someone say something? Okay. We'll move on to items for consideration and to the old business. We're at TR 200311. What is your pleasure?
So move.
Support.
Is there support?
Yes, ma'am, I'll support it.
Okay, is there any discussion on the motion?
Madam Chair, this is Commissioner Laring. Commissioner Mahoney. Madam Chair?
Yes, yes. Is that Commissioner Larry? Yes, go right ahead.
Yes, I'm on now. Thank you. So I
Okay.
actually had a comment going back to the transportation information update. It was disclosed that none of the information of the riders could be made available. We didn't know where those riders were going or what they were doing. That entire transit update was speculation. We don't know what those riders are doing or where they're going. Our health advisor 3 weeks ago advised us to shut this bus completely down, and we didn't do it then. Matt, this whole motion that we've got right now is after the fact. We're at about 50% right now because transit took that upon themselves. We're looking at New York for leadership. New York has a pandemic on their hands, and this is spreading wildly in New York. I don't know why we're looking at them for any form of leadership. They're doing the exact opposite and quite possibly spreading it around New York. We need to close MATS completely down. We don't know where those riders are going. That the whole update was speculation. We need to close the MATS completely down. They've already shut the buses down. This motion actually needs to be removed because Mr. Coons has taken that upon himself already because of the lack of board direction in the first place.
This is Mark. Could I speak on this agenda just to remind people?
Go right ahead, Mark. I was just going to call on you.
Thank you. The reason this is back on there is because the last meeting we tabled it, and under our policies, we have to bring it up at the next Transportation Committee meeting. Since then, you're correct that we've since then went to Saturday routes. So the interest of this motion here is not interest of the staff, just the fact that we're following our current policy that it had to bring back up. And also one other point, it should be number 8 versus a number 11. Thank you.
There's a motion on the table, correct?
Yes.
Realstein, Madam Chair.
Yes.
A couple of issues I have with not looking at New York, but looking at Grand Rapids, which expanded the number of buses they had running so that they could distance people more. They weren't interested in shutting the buses down. The other thing is, in terms of the people riding the bus, they were probably the least likely to have traveled anywhere that would make them infected. They don't come up the I-96 corridor from Grand Rapids to Detroit. They don't come in on the airport. They have been the self-quarantined people in Muskegon County for the last 30 years. So they probably are not the ones that are going to be infected in a heavy amount. But if we shrink the number of buses, then you have the issue that Jim has just brought up in terms of a chaser, trying to spread those folks out in certain issues. So yeah, I'm not real excited about reducing at this point. Puts more people in danger.
Well, Ken, I think that this is something that we need to get together and discuss, and Mark should be in on this before we just give out a decision on it. And we can take some time to review this request and then bring it back to the board. Okay, where are we on the agenda?
I guess I'm wondering how we're doing this because it's a motion on the table.
Susie?
Yes, ma'am.
Or Marcia? Okay,
go ahead, Marcia.
Go right ahead.
Yeah, it seems like this is no longer relevant, given that the bus system needs, as Ken pointed out, needs the extra buses for chasers to spread people out. So I think we should. I would be in favor of not. I would not support it. They need most flexibility.
Well, this is why I wanted us to discuss it later so that we could have, more discussion on it.
And I would make a motion that we postpone this decision.
Yes. Is that a motion?
Yes,
Madam
ma'am.
Chair? Okay, is there support?
Yes.
We need a date.
Okay.
So the next
You want-
Transportation Committee meeting.
End of April,
Okay, it's
April 30.
right.
So I have a question about postponing it. I'm not sure why we're postponing something we're already doing.
I don't know either, but I don't know how to, it wasn't my motion, so I can't take it off the table.
I
So
think
I'd
we
like to
need
make a
vote it
motion to
down.
have this removed from the agenda. It's already done. It happened without our permission and without our guidance.
We can't
It's the
have
right thing
three
to do,
motions
but
on the
it
table.
just,
So I would recommend that the person who made the motion withdraw it.
Madam Chair, that would be me. This motion was made a month ago, maybe a little longer, and it was tabled by Commissioner Hoovie Wright. And I do agree at this point, it is a null and void motion, so I would motion to remove it.
I will support that.
Thank you.
Is that a motion? Was that Gary?
Yes,
Is that a
and
motion,
seconded by Susie.
Susie? Okay,
Call for the question.
we can call.
Hold on, hold
All
on.
in favor?
What are we voting on?
To remove that motion.
To remove the motion off the agenda.
Yes.
There's a motion to remove the motion and the withdrawal.
Yes,
I mean,
it's been withdrawn.
Okay, support, right?
Yes.
All in favor?
Yes.
Yes.
Signify by saying yes.
Yes.
All
Yes.
opposed? Roll call, please. I couldn't tell the difference.
Commissioner Foster,
Yes, to have it removed.
Commissioner Hovey Wright,
Yes, to have it.
Chairman Hughes,
Yes.
Commissioner Laring,
yes.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick. I can't hear you, Commissioner Skolnick.
He's muted.
Do a thumbs up.
Unmuted, sir.
Oh, it is. Yes.
Thank you. Commissioner Snyder
Yes.
and Commissioner Wilkins.
Yes. And the motion.
That would be
is
9
carried.
yes.
Okay.
New business.
Yes, Madam Chair, may I start?
Yes, Commissioner Snyder, or is it Snyder or is that
It's
Larry?
Gary Rillerstein.
Oh, okay. It sounded, okay, go right ahead.
Madam Chair,
Gary.
I'd like to remake a motion, but I don't know how to say this. I'm going to start all over. I'd like to put the mats under the direction of the Public Health Director for the guidance of how many buses should be on the road. Did you hear the motion?
Yes, the motion is to transfer
The direction.
mats to
Yep.
the Public Health
Public Health
Director.
Director.
Right. Is there a specific time or?
Until this COVID-19 is beyond us.
Okay, is there support to this motion? Hearing none, it fails. So we'll just move on.
Madam Chair, I'd like to make a motion. This is Commissioner Laring.
Okay, go right ahead, Commissioner Larry.
I would like to make a motion that we stop all MATS transportation and lay off the employees.
No.
Okay. I'll support it, but I have an issue.
Is that Commissioner Snyder?
No, it's Gary again.
Oh,
Willis, and I
Gary.
supported it.
Okay, all right. Yes, well, we're open for discussion.
And may I go first?
Yes,
Supported it for stopping the mats, absolutely, but the laying off of the employees, I'm not going to stand behind that part.
That's part of the motion.
I understand. So I just made my own personal. I still support the motion now.
So this is Commissioner Laring that we're open for discussion. We've had 4 people die already in Muskegon County from COVID-19. One of the individuals that was riding the bus that died was a bus rider. He rode the bus on Friday the 27th and died the week after that. He was actually diagnosed with COVID-19 previous to that and was riding the bus. We do not know how many people have been infected by this already, but we know that a significant number of contacts were made. So if you overlay the information we got from the health department and overlay the MATS map that we're currently running, you can see the potential for COVID-19 to spread in our community through MATS. I think it's absurd that we would follow New York City when they have the most cases in the United States right now and are having a pandemic. I think we should probably do the exact opposite of what they're doing in New York City. And it's quite possible that the spread of COVID-19 in New York City is happening on their mass transit system. So I am recommending, I have been suggesting that churches would start to pick up the load and start to reach out to their communities. There are people that do need to get groceries, but they are not going to step up as long as we're meeting that need. I think that the community can reach out to their neighbors and we can all participate. Each one of us commissioners could offer to give other people rides instead of paying somebody else to be in harm's way if we're that concerned about it.
Thank you, Commissioner Laring. But I might want to add here at this point, there are a lot of poor people in our community, and I'm not so sure that stopping the buses, they are going to have some kind of transportation. I think we need to take another look at this and look at it, and consider all of the people. So I would like to see this postponed until the next meeting.
Commissioner?
Yes.
I would like to co-sign that what you're talking about, because I think sometimes we have to really make sure that we understand what a lot of poor people are going through.
Mr. Nash,
for some
will you
reason,
speak up a little, please?
I think we have to make sure we understand what poor people are going through. And maybe some of us do not quite understand that. But there are people that he's taking statistics from that says they have no ability to get around, or they have no one there who can help them whatsoever. God forbid they get sick and maybe need to take a bus to go to the hospital, but can't get there. Never mind the fact that I appreciate what the MAX team is doing out there, making the changes that they're making, cleaning the buses, doing the things necessary to try to protect themselves and the people that they serve. Not only that, but I'm very happy with our federal government, who is also giving some support to this service that we provide, so that we can actually use the support that we get to actually improve social distancing by adding more buses, so that some buses can be clean while other buses are running routes. This makes a lot of sense to me. I think we're doing the best we can to make this work for the people that really need it. And just because certain people don't need it in their area doesn't mean they have to step on people that really do need it.
Thank you, Mr. Nash.
Madam Chair, I'd like to make a comment again, if I may.
Commissioner Larry, go right ahead.
So Commissioner Nash just suggested that people that are sick might need to take the mats to the hospital. That's the exact opposite thing than we want them to do. If they're sick and they need to go to the hospital, they need to call 911. We don't want them riding the mats. Secondly, I'm sorry, I'm on a construction site and it's hard for me to hear right now. I take offense to the idea that we can't, that I don't understand the plight of these, the disadvantaged people in our community. is those people that I am trying to protect.
Well, I take resentment to the fact that we have people talking about they can just call somebody and get a ride. Why do we think they're riding a bus? They can't call people to get a ride. And if you think an ambulance is going to come pick up everybody that thinks they're sick,
They can't
that's not
afford
going to
that.
happen either. The healthcare system is overloaded right now. These people don't have any other way to get anywhere.
Madam Chair, may I?
And I'd
Yeah.
like to speak as well.
All right, Commissioner Harvey Wright, as soon as he gets done.
Sure.
I just want to comment on Charles's comment. No disrespect, sir, but this virus does not determine rich or poor. It doesn't care your value. It will kill you, and that's why we're trying to shut the mats down. We know it goes from transmission. Hence my motion, let the health director take over the mats, even if it means putting twice the buses on the road. It would be safer. Thank you, Madam Chair.
Thank you.
Yes.
Mr. Harvey Wright.
Yes, Mr. Laring suggested that people can use their churches. Well, this day and age, there are a lot of people that are not connected to a church, and churches don't necessarily have the means to do that. So it's kind of an empty alternative, an inadequate alternative. So that's just my comment on it. Thank you. And I agree with Mr. Nash that the people that are using it now, I don't think we I don't think we can take that away.
Right.
I know Mr. Laring wants to privatize the whole bus system. That's not going to happen.
Can I say one more thing just so I can share that?
Commissioner
Sometimes
Nash or Larry?
we have to
Okay.
understand that some of the people that we're talking about that rides this bus, just like we're talking about with all these other services, they're not as informed. They're not as connected as we are. I understand that people shouldn't go shopping with a bunch of people in there, but a lot of people do not understand this COVID. They do not understand to call somebody. They don't even understand to call 211. There's a disconnect with a lot of different people, and they have a very different take and a very different viewpoint on it. And just shutting down the mats is not going to solve the problem. And yes, it's unsafe, period. But the thing is a lot of people don't know this, and also a lot of people just don't have the education and training to know to connect with certain services by different means. All they know is to get to that bus stop and get where they got to go and get what they need. And some of these things are very essential for them, but having another, I mean, it's easy for us to say, shut it down, let them figure out a way when we have cars. That's easy.
Well, I think that this is will be such a drastic decision. We really need to look at this a bit more and not jump out here and just cut it off for the moment. I think Mark and the commissioner we should go back and then talk about all of the inside and outside of this decision. And I think I'll take a roll call on that.
I'd like to say one thing, Commissioner, a couple things.
Okay.
First of all, speculating as to how the transmission is occurring is just that, speculating. I drive by occasionally, the mire or the parking lot is full. All of those folks are not self-containing themselves. All of those people who are not necessarily riding the bus are exposing themselves and others to the same thing in Myers. So unless we're going to suggest closing Myers down, I don't think closing mats is that, without data, a good idea. I don't know if it's transmitting there or anywhere else.
Thank you, Mr. Mahoney. And I think that we had a motion on the floor.
Correct.
If not, I'll entertain a motion.
No, we have a motion on the floor.
We have a motion.
Yeah, there was a motion.
We have
What
one on the,
Repeat the motion, please.
Keep the motion.
Repeat it.
Yeah.
Kathy, can you repeat the motion?
Yeah,
It was a motion made by Commissioner Laring to stop all MATS transportation and to lay off all of the workers.
Oh,
and,
that
and
wasn't the motion.
I have a comment to that, if I may, Madam Chair.
We have enough.
Madam Chair,
Yes,
can you hear me?
yes,
So,
I can hear you.
Thank you. So this is a committee meeting. The idea that we would continue this into further discussion. This is the perfect opportunity to continue that discussion. This is only committee. It has no value other than putting it on the agenda for the board. So please, in consideration of this vote, realize it's just pushing it to the next full board meeting so that we can have this discussion.
Where's our
There's a
attorney?
motion on the floor, right?
Yes.
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 We're voting on now?
Well, okay, well, we can vote on it. We can vote on it now.
Roll call.
Commissioner Hovey Wright.
I vote no. I would like to add that, when you vote to lay off all the people at MATS, that's discriminating against all the other county employees, and we haven't made a decision about
Continue with the roll call, please.
layoff. So,
Chairman Hughes.
Yes. No, wait a minute. I want no. I don't want to do this.
Thank you. Commissioner Laring.
Yes.
Commissioner Mahoney.
No.
Commissioner Nash.
No.
Commissioner Skolnick.
No.
Commissioner Snyder.
Yes.
Commissioner Foster.
Yes.
Commissioner Wilkins.
No. What is the count on that?
That would be 6 no, 3 yes.
The motion fails. So we'll move on to what's the next item? We'll
Move on to new business.
okay. Is there any new business to come before this board?
That was new business.
Okay, we'll move on to public comment. Is there anyone who wishes to make a comment?
Yes, Ann Derwin. I want to let you know that there are people that want to make public comment and they can't get in. So this system is not a good one. Something has to be done. Also, I am concerned about our bus system. Yes, I am very concerned about those who can't get to the store and whatnot. But, and I take issue with Charles Nash as far as that. We don't know, we can't feel about these people who are poor. You bet we can. That's why we're bringing up this issue and want to talk about it. I am so disappointed, you commissioners that voted to not put this into the committee and talk about this some more. Some decision has to be made pretty darn quick. Lives are at matter, and you can shake your head all you want.
Thank you. Are there any more comments?
This is Mark again. So those who are calling in would have to be unmuted to be able to speak.
Mark, there are people calling on their phones that can't get through. This is Ann, just to let you know.
Thank you, Ann. Mr. Phillips, do you have anything on? Have you unmuted callers 3, 4, and 8?
Certainly. All 3 of them are now unmuted.
Okay.
Hello, can you hear me?
There's
Hello,
one.
yes, hello, can you hear me?
Yes,
Can you hear me?
we can hear you now.
Yes.
Hello, this is Melinda Peggle. Can everybody hear me?
Yes, Melinda.
Yes, ma'am.
Okay, I tried to make public comment earlier at the beginning, and I wasn't able to be heard, such as Commissioner Leering was also muted. Your public health director has said numerous times, several times, that the mats should no longer be running. Your transportation director, Mr. Coons, has said they cannot appropriately social distance in a 35-foot bus. His words, it is near impossible. Kathy Moore, your public health director, has said there are other resources for the community to receive food and transportation. I suggest that you make a recommendation. Maybe you can print out a form for your public transportation riders and you can distribute them upon your closure and have them have the information for 211 and these other resources. All of you there should have access to prepare a resource list for those passengers. And also, there are a lot more population in Muskegon County that do not have access to the mats because we are outside of the service district. Do you not think there are poor and elderly outside of the mat service district that do not have the same needs of health care and foods and appointments as everybody else does? They sure do. And somehow they have what they need, hopefully. Thank you.
Thank you for your comment. Where is the agenda? I don't want to ask Randy. Are there any more public comments? We'll move on to items for consideration.
No.
Oh, do we have any final board comments? If
Madam
not,
Chair?
I'll entertain it. Yeah.
Madam Chair, real quick. I know,
Yes.
I'd like just to make a recommendation, if it's possible, for Ms. Moore to contact Jim Coons, our Director of Transportation, and give some advice, give some guidance. Let's see if we can't help instead of hurt where we're going. Thank you.
Thank you.
Yes, thank you for the comment, and we will take care of that.
Thank you, ma'am.
I'll call for adjournment.
So moved.
Support.
All in favor signify by saying yes.
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 All opposed? The motion is carried.